Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over the top 5 things that you will never miss about nursing school. I remember as a new nurse reflecting back to my nursing school days, and there were some things that stood out that I will never ever miss about nursing school. And in this video, I want to go over the top 5 things, and after the video, I would love for you to comment and let me know some things that you'll never miss about nursing school, because I love hearing from you all. So let's get started. Number 5, those ugly nursing school uniforms. Let's face it, those uniforms that they make us wear in nursing school, those are the most unflattering, ugly things I have ever put on ever. I remember being so excited about clinicals. I'm like, yes, I get my first real pair of nursing scrubs, and then we get the little syllabus for a clinical rotation. It's like, you have to have this color scrubs and it must have this logo on it, and it was so many requirements of what I had to wear. And then I went to the bookstore, the scrub shop, to get the scrubs, and I was like, oh man, seriously, that's what I gotta wear? So I am not the only one who's thought that, because I've been at the hospital with other nursing school rotations and they complained about their uniforms as well. So let's just face it, those nursing school uniforms, whenever we're done with them, the best thing to do with them is just burn them, because they are ugly. And the perk about being a nurse is that at least you can find different patterns and different designs if you're not color coded, because some hospitals are color coded where you have to wear a certain color, but at least you have a little bit more options than the ones that they provide us in nursing school. Number 4, doing a care plan on a patient that got discharged. I don't know about you, but I absolutely hated when this happened. What I would have to do before my clinical rotation, I would have to go the night before, pick a patient, and develop a care plan on them. And if you've ever done a care plan, you know that they take anywhere from 2 to 4 hours, depending on how in-depth it is and what you got to research. Well, I would always go to the nurse and I would ask them, hey, is this patient getting discharged? Because I don't want to come back the next day and they've been discharged. And they would normally tell me yes or no. Well, a lot of times they would tell me no, so I'd go get all my information, I'd go home, work tirelessly on my care plan, then I would come back that morning and find an empty room or another patient in that room, and that patient would be gone, and my care plan would be useless. So at least whenever you become a nurse, whenever you do a care plan, you're going to implement it and that patient's not going anywhere. But in nursing school, that tends to happen, and that is very frustrating. Number 3, having to spend all that money on tuition and textbooks. As a nursing student, you are just a little bit strapped for cash, because after you pay tuition, pay for your textbooks, pay for miscellaneous clinical fees, uniform supplies, everything like that, you don't have much change to spare. So that is definitely one thing I'm not going to miss about nursing school, because at least now that I'm a nurse, I can work and I can earn a paycheck. Because in nursing school, you are free labor in a sense, because you go to clinicals, you do everything for free, and you're not getting a paycheck. So that is one thing I'm definitely not going to miss. Number 2, having a clinical placement that is 100 miles away. So as a nursing student, you are really excited about clinicals, right? Because this is where you can actually go and learn how to be a nurse instead of sitting in a lecture class. Well, I remember being so excited until I seen that my clinical placement was like 100 miles away. So that puts a little bit of a damper on things. As a nursing student, especially if you are in a city and you want to do your clinicals out in a rural area, because that's the subject you're learning, you may have to drive several miles to get there, which means getting up at 3 in the morning so you can get there at 5 in the morning. So I'm definitely not going to miss those drives, because usually as a nurse, you can get a job, hopefully, that's close to where you live and won't have to drive 100 miles to get there. And number 1, the constant cramming and studying for exams. This had to be number one because nursing school is like back-to-back exams and your brain is literally, it's like it can't take anymore. You're constantly cramming and studying. Not only are you studying for your lecture exams, but you're studying for like HESI or ATIs, those progression exams. You're preparing for NCLEX that you're going to take after you graduate. You're doing projects, you're doing care plans, you're going to clinicals, and your brain really hurts. And that is definitely one thing that I will never ever miss. And I know a lot of other people I went to school with, they don't miss that as well. Because whenever you become a nurse, you can go work your 12-hour shifts. Say you work 3 or 4 12-hour shifts a week. You clock out, you go home, and you relax, you rest, and you don't have to study for a test or do a care plan or cram or do whatever. It's so nice and so awesome. So remember, nursing students, if you're having to go through this right now, it's totally, totally worth it because one day you'll be a nurse and you won't have to study or cram for exams anymore. Okay, those were the 5 things that I think you will never ever miss about being a nursing student. Now use the comment section below and let me know what you will never miss about being a nursing student. And if you haven't subscribed, please do so, and thank you so much for watching.